Hi, my name is Paul Yao. I'm a board-certified orthopedic surgeon. I specialize in hip arthroscopy, preservation, and anterior hip replacement. So the majority of my patients who come in with hip pain actually don't have end-stage degeneration of their hip, and they don't need a full replacement. They can actually have their hips saved or repaired with what's called hip preservation surgery or hip arthroscopy, which is a minimally invasive method of repairing hips instead of replacing them.
I'd been having a little pain in my right hip in that joint for quite some time, and I just ignored it. And so when I was in Israel, I was doing a project, and I was in a squatting position painting I was probably squatted for about 15 minutes. And when I stood up, my hip felt stiff, so I kicked it out to the right really hard, and it dislocated. When I went in to see him the first time, we had a really connection there. And so I explained to him, he asked me what happened, and when I explained to him how it happened and what I had been doing, he knew without even touching me what my injury was.
Current theories on why people end up having cartilage damage is actually that somewhere during their developmental period, either during adolescence or during their growth spurts, the hip joint actually grows out of round. Some people describe that the risk factors for that happening as being overuse, particularly over-specialization in sports, playing too much of one sport without rotating through the various activities can actually lead to this developmental irregularity. And then as they continue using this irregularly shaped hip, that leads to a tear or to further damage.
Well, he explained the procedure, and he was really nice about it because he talked on a medical level with me, and so it helped me understand, but my husband didn't really understand as well, kind of the terminology. And so he would talk with me on a certain level, and then he would explain to my husband. And so I thought that was extra special. Another cool thing I thought was good was when he did an injection into the joint and used the ultrasound, he let us look at the screen and took the time to explain exactly what was going on and showed my husband exactly where the tear was and what needed to be done.
So the benefits of the intra-articular injection, again, is to give you an idea of, A, is that the source of your pain, but also know what it feels like to have the problem fixed. So obviously an injection is a temporary measure, but it gives you an idea of what the permanent fix will feel like before you actually go through the surgery or through the procedure. The arthroscopic hip procedure involves 3 poke holes, one for a camera, one for a sewing needle, and one for a shaver. The camera allows us to visualize the damage. The sewing needle allows us to sew or repair the damaged cartilage, and the shaver allows us to reshape the defect and restore balance to the joint.
He told me that I had a tear in the labrum, and so they would go in and he explained the procedure where they would put an anchor in and suture the cartilage back together and bring it together. And the suture would hold it and until the body accepted and grew that cartilage back where it needed to be. And then also that the femoral head was odd-shaped and had some arthritic degeneration in there. So he was going to have to shave that bone down. And by shaving the bone down, it makes it vulnerable until it regrows to breakage. And so that's why you're non-weight bearing for the 3 weeks.
The typical experience or the typical outcome or results after hip arthroscopy, because it's minimally invasive, people will start to feel better as soon as 3 to 4 days out from surgery. Though I've had some folks say that their hip pain is completely resolved within a week after the surgery. Unfortunately, because it's a repair, it needs to heal, and there needs to be a recovery period which can take as long as 2 or 3 months to fully recover from this surgery.
This was one of the things I was very impressed with. I would call, and if I had to leave a message, they called back very soon and answered any question and didn't make me feel like, you know, made me feel like I could ask anything.
Unfortunately, hip arthroscopy is not a very common procedure. There are really only a handful of centers across North America that are equipped well enough and have the expertise and also the equipment to perform this procedure. And at this point in time, to the best of my knowledge, in Knoxville, probably even in East Tennessee, I am the surgeon who performs the highest volume of this procedure.